Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the Department of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. I welcome Dr. Sophia Shakur. Actually, we're welcoming you back. You are currently a staff neurosurgeon at Peninsula Regional Medical Center, and you also work with Peninsula Regional Neurosurgery practice in town. But this is sort of a welcome, sort of a homecoming for you, because you actually were born and raised in Salisbury, went to medical school at Hopkins and so forth, have 8 years of neurosurgical training, and decided to come back here to practice. Thank you for doing that, and thank you for being on the program. We're going to talk about brain aneurysm today, and that's one of your specialties of practice. But so glad you could come back to Salisbury and be of service to us here.
Yeah, thank you very much. I'm very happy to be back home and happy to be serving, the community that did so much in terms of my education and interest in neurosurgery to start.
Well, this is a very it's not so prevalent compared to many other medical topics, but people certainly hear about these, the brain aneurysm. So that's why we thought we'd do a show on it to kind of clear up some misconceptions about what they are and what the risk factors are. So tell us about what a brain aneurysm is.
Sure. So a brain aneurysm is a bulge in a vessel in the brain. And specifically, it's a bulge in an artery in the brain. And it typically forms in weak areas of the arteries in the brain.
Is there a usual area where it tends to occur?
Typically at junctions within the arteries. So the arteries are sort of like little roads in the brain, and they branch. And it's at those branch points that aneurysms typically form.
I know we were talking before the program because, I have known some people several years ago that were fairly young and would die from a brain aneurysm, and I was always under the impression, or people would say, oh, it's a congenital thing, and you're saying it's not. It's usually an acquired thing.
Right. So in general, brain aneurysms are not congenital, so typically people are not born with them. Instead, we think that aneurysms form with time in the brain, so they typically tend to occur in middle-aged adults. So in the 40s or 50s.
Although you can see them in younger people?
That's true. So they can still happen in younger people. There are specific genetic syndromes or disorders that can be more prone to forming aneurysms in the brain, but those are more rare.
What would be examples of those? And you're saying they are rare, however.
Right. So connective tissue disorders such as Marfan's or polycystic kidney disease, those are the more genetic syndromes that can be associated with brain aneurysms.
And I guess it's nice to know that because you can do some screening ahead, because we don't typically screen for brain aneurysms because they're fairly rare.
Correct. So brain aneurysms typically occur in about 1 to 2% of the population. And just as you said, we do not recommend screening for brain aneurysms unless there's a family history of aneurysms. So if in your family there's a first-degree relative who had a brain aneurysm or happened to die from a brain aneurysm that had ruptured, then you should tell your primary care doctor, and they can refer you to a neurosurgeon, or the primary care doctor can order a screening test to look for an aneurysm.
That's very good to know.
Yeah.
What are some other statistics related to brain aneurysms?
Right. So an aneurysm can be found either incidentally, meaning a patient had a test to look at the blood vessels in the brain for another reason unrelated to the aneurysm, and the doctor happened to find the aneurysm. That typically is found in about 1 to 2% of the population. Then there's another set of patients who find out they have an aneurysm after it ruptures or causes a bleed in the brain. And those certainly are the most devastating cases. There are about 30,000 cases of a ruptured brain aneurysm in the United States each year. And out of those 30,000 patients, approximately 1/3, unfortunately, don't even make it to the hospital. Out of the remaining patients, about a third will survive with a permanent neurological deficit, or there's another third of patients who will survive without any significant neurological deficit. And so those patients tend to do quite well as long as their aneurysm is treated right away.
Do they tend to occur like during the night or when one's sleeping, or is it generally when you're up and about and you tend to have the symptoms and just can't get to the hospital quick enough or ignore the symptoms?
They can happen any time of day. Oftentimes an aneurysm will rupture even when a patient is just sitting down watching TV. That can happen actually quite commonly, or it can happen at night. So there's no specific activity that has been linked to an aneurysm bleeding.
Well, before we get into the diagnosis and treatment and symptoms and so on, let's talk about the risk factors.
Okay, so actually just being a woman puts you at a little bit of a higher risk since aneurysms are more commonly found in women. Again, they tend not to be congenital, meaning they form with age. So increased age is actually a risk factor as well. Additionally, a history of high blood pressure or cigarette smoking have also been linked to aneurysm formation and rupture.
And what would the symptoms be then? I guess if it's small enough, someone wouldn't even have symptoms. But is it that they grow in size or start to leak a little bit? So what would the typical symptoms be?
Okay, if an aneurysm is found incidentally, typically patients have headaches, a history of headaches, but they're more the mild type of headaches. They might be actually migraine type headaches, and that patient ends up having a test to look at the brain or the blood vessels in the brain, and then with that test we happen to find an aneurysm. So typically they're very non-specific headache type symptoms. However, as you mentioned, if an aneurysm is large enough, it can actually create mass effect in the areas of the surrounding brain, and so you can actually develop focal neurological signs, for example, weakness or numbness in a particular part of the body, or you can have eye symptoms, difficulty moving the eyes resulting in double vision or vision loss, and those typically happen in the larger aneurysms, and that's another reason why a patient might find their aneurysm ahead of time before it bleeds.
Now, once it ruptures then, they can have even more severe neurological symptoms?
Correct. So the typical presentation for a patient who has a ruptured aneurysm in the brain that has bled is a sudden onset, very severe headache. It's also characterized as a thunderclap type of headache. And the reason is because you have a sudden bleed that happens in the brain, and this severe headache can start very suddenly.
So that would be a sign that you need to get medical attention immediately. It's not the typical headache that kind of just starts coming on slowly.
Absolutely. So a very bad headache, the worst headache of your life that happens suddenly, is very characteristic of a ruptured aneurysm. On the other hand, certainly there are patients with a ruptured aneurysm who have a very severe neurological problem, and these patients are typically comatose. So it's also possible to have a ruptured aneurysm in a patient who is unresponsive or has other stroke-like symptoms.
Yeah, that's what I was thinking. We talk a lot about how to recognize a stroke, and a lot of those symptoms would be, we tell people call 911 if you see them anyway, because it could be a stroke going on.
That's right.
Okay, so diagnosis, someone comes to the hospital, and I guess either way they're going to get this diagnostic test, you say, the MRI or the CT angiogram?
Right. So the tests that are used to look for an aneurysm in the brain involve tests that look specifically at blood vessels in the brain. So these are generally called angiograms because it's a picture of blood vessels. In this case, it's done in the brain, so it can be done either as a CT angiogram, an MR angiogram, or as a catheter angiogram, which is actually the best test to look for an aneurysm, and it's considered the gold standard test. So this is done with a catheter that's placed inside the blood vessels, and dye is injected through the catheter, and then an X-ray is taken to look at the blood vessels in the brain. And the reason why this test is the best out of all the ones that we've mentioned is because the resolution of this test is the highest. You can actually see aneurysms as small as 1 millimeter on a catheter angiogram, whereas a CT or an MR angiogram generally is good for as small as 3 millimeters.
Oh, okay.
Mm-hmm.
But can this be done quickly if someone has a leaking aneurysm or something that's ruptured? You do this rather quickly, I imagine, so you
Absolutely.
can get them into
Absolutely.
surgery?
Yes, so anytime a patient comes in with concern for a ruptured aneurysm, it's considered a medical emergency, and we are well prepared to take care of these patients, to do an angiogram immediately and to treat it.
Get them right to the OR then? You say there's a couple different procedures you can do in the operating room?
Right, so treatment of an aneurysm can be done one of two ways. The first way is with traditional open surgery, where an incision is made on the scalp and a craniotomy is performed, meaning an opening in the bone of the skull. And then we dissect in the spaces around the brain, not directly through the brain, but in the spaces around the brain where the blood vessels are found. And then we find the aneurysm and we place a clip on it, typically made of titanium. So it's a titanium clip. The second method of treating an aneurysm is through neuroendovascular surgical approaches, which is a relatively newer technique. And the charm about this procedure is that there's absolutely no incision that's made. In fact, it is done through a needle puncture in the groin area. So there's a fairly large artery at the top of the leg called the femoral artery that we're able to go in and then pass a catheter all the way up into the brain and then into the aneurysm. And then we fill the aneurysm from the inside with coils. So with the neuroendovascular surgery procedures, everything is done from the inside of the blood vessels, whereas traditional surgical techniques are done from the outside of the blood vessels.
Putting a clip on the
Right,
outside of the vessel.
right.
Why would they all not be done the other way then? Because I imagine there's much less issues with complications from maneuvering within the brain itself.
Well, actually, it really depends on the location of the aneurysm, the anatomy of the aneurysm, what it really looks like. There are situations actually where clipping an aneurysm with an open surgical approach is favored over the endovascular approach. And all of that information that from the angiogram is used to determine what approach is best for a patient. There have also been studies comparing the two techniques, and generally, if an aneurysm can be treated from inside the blood vessel with coils, it's generally used. But if clipping an aneurysm is thought to be better for a patient, then that is done as well. So it's all depends on the individual patient, and each patient is treated differently depending on their situation.
And it sounds like it is very important to do that angiogram first to figure out exactly where the problem is.
Right, you're absolutely correct about that.
Well, it sounds like amazing surgery, and I guess the key is you got to be one of the lucky ones who it's picked up incidentally, or you have some warning signs, because it sounds like once it ruptures, I think you said 2/3 of people are either not going to make it or have some kind of neurological deficit. But I guess you do have a lot of success stories.
Absolutely. Anytime a patient is brought to the hospital quickly enough and is treated appropriately, there are a lot of great outcomes, especially in younger patients and even in older patients. But certainly that's what we're trained to do, and that's what we devote all of our attention and effort to achieving is a good outcome in a patient.
Well, very good. I think to wrap up, I guess the first thing we should say is if you have one of those horrible headaches, that don't ignore it. Seek medical attention immediately. To the ER, I imagine, would be the best place to go in that situation.
Absolutely. If you have any of the signs or symptoms of a ruptured aneurysm that we mentioned earlier, it is imperative to call 911 and get your family member or friend or whoever to the emergency room as soon as possible so that they can be treated.
And the same goes for those similar symptoms of stroke. It's all call 911, get to the ER.
That's right.
So I guess let's talk a little bit more, re-emphasize prevention, which is a lot of common sense things. So let's go through some of the common sense things. And these are actually things for good heart health as well, for heart attack and stroke. So you said don't smoke.
Right, so don't smoke. I would also say make sure your blood pressure is under good control. If you're diabetic, make sure that your blood sugars are well managed. Also, avoid recreational drug use.
Isn't cocaine a particular problem?
That's correct. Cocaine is one of the main recreational drugs that has been associated with aneurysm rupture and formation.
And then, of course, healthy diet, exercise. It says limit caffeine. Is that true?
That's true.
We have a coffee-oriented culture.
So I would say a lot of it is common sense. So if you can avoid anything extreme, or the best advice is everything in moderation and a good balance.
I think all our parents said that for years, and it still rings true.
That's right.
Moderation. What about straining? One of the publications I'm reviewing says avoid straining, about weightlifting and things like that, but yet we tell people to exercise. And
right.
So I guess if you're at risk, or...
Well, obviously if you don't know that you have an aneurysm, then doing any activity in moderation is okay. If you happen to know that you have an aneurysm and it has not been treated yet, then it might be good to avoid, a lot of exertional activities and things like that are more extreme and out of the norm.
So it definitely is important to know if you have a family history to get screened, because otherwise this is not something that's typically screened for, and it's fairly low prevalence, but obviously if you have symptoms, call 911, get to the ER. Right,
that is important to emphasize again. If you know that you have a family history of brain aneurysms, particularly in a first-degree relative, so your parent or sibling, then there is a recommendation to have a screening test done. Typically it's done with an MR angiogram so that you can avoid the risks of radiation with the test.
Okay.
Yep.
Well, very good advice, and thank you so much for being on the program, and thank you for coming back to Salisbury to practice here. It's hard getting good doctors to this area sometimes, and we're thrilled that you could come back and be in the neurosurgical team here.
Yeah, thank you very much for having me, and I'm glad to have shared some of this information with our community.
And thank you for joining this edition of Focus on Health here on PAC 14.